Hi everyone, magandang araw po sa inyo. Welcome po to another episode of KaiZEN, the Magsanoc podcast, powered by TayoTayo.Health. Ako po si Kai Magsanoc, ang inyong host and interviewer. And today, if you've noticed, no, we've been focusing on more healthcare talaga and wellness. And last time, when we had Pierre Magdangal of Cordwise, which is a portfolio company of Pulse 63, I also disclosed that TayoTayo.Health is also a portfolio company of Pulse 63. And I'm very excited because today we're going to be speaking with the managing partner of Pulse and also the president and founder of Equilife Medical. So what we want to do is to help our listeners and our viewers with their the health sa bahay, no? Or kahit saan man. So we're providing you with options that you can take or hopefully your family can also take. So let's welcome our guest. It's no other than the pretty lady with the perfect winged eyes, Miss Abetina Valenzuela-Mader. Hi,
Hi.
Abet. Good morning.
Hi, morning. Hi, everybody. Kai, thank you for having me here. Really excited.
Oh, I'm so happy you accepted our invitation, Abet. It's our honor to have you, no? Abet is younger than me, full disclosure, but she is one lady I really look up to. So, Abet, how are you today? I can see the Christmas tree behind you. Pasko Pasko na.
It's December 1, so of course, the tree has been up since October 30. So, um, true Filipino style. It's been up for a while, and we're really excited. Everyone's rushing. It's Christmas. But still very happy that we all take the time to still spread the the topics of healthcare, share with people what's available. So yeah, I'm really looking forward to this.
Okay, so we're here to talk about Equilife Medical. And as a marketer, you never assume that your viewers, your listeners, or even your readers have heard of you, no? So let's speak with those who have never heard about Equilife Medical. What is it and what do you do?
No, thanks for that. So Equilife Medical is a vertically integrated equipment service and equipment provider in the critical space. So kind of sounds like a lot. We are a back end company, so we help hospitals operate their ICUs, their pulmonary labs. That means we provide people to operate on site. So these are trained nurses, trained respiratory therapists. We provide quality equipment, high grade movable equipment like ventilators, breathing devices, patient monitors, just almost everything you can find inside an intensive care unit. We put them in hospitals so hospitals can use it anytime and they can adjust the size of their ICUs faster. So we've been open for a decade now. We've just gone through COVID, and that was the time that, very sadly, but it's a reality, everybody finally understood or knew, non-medical people, that is, what a ventilator was. But of course, this has been used for many years, and
Okay.
I guess that's where we started to appreciate the technologies in respiratory care more, because it was one of the, if not the most used equipment during this time.
Yeah, and I think after COVID, 'di ba, there is a science to long COVID. So yung flu, yung cough and cold nag-iba. So it's so much more important to know for people who can't afford to go to the ICU. I mean, if they would resort to home care, where they can rent these machines. But we'll go into that further later in the episode, so please stay with us. Abet, how did the idea of founding a business like Equilife Medical come about? Parang what gap were you trying to fill? Kasi if I'm correct, no, hindi ka naman doktor. Alam mo yon, para kasi people might assume maybe she's a healthcare professional, no? Hindi po. Pero she is an entrepreneur in the healthcare space. So that
Mhm.
is my question, Abet. How did the idea come about?
Sure. So when I was 24, that's when I started Equilife Medical. My background is in business. and a bit of engineering. I was working for my family business, and my part of my family business was importing and selling these devices. So that's what made me understand most every type of equipment we move. It started with that understanding. It started with knowing how to move things from point A to point B. And that's how I got into the understanding of healthcare in that scenario. Um, I knew I wanted to open a business. I wasn't sure what, but what I was sure of was in our country, there's a bit of like being nationalistic here, or wanting to always improve things here at home.
Mm,
Was to There were three things actually when I was growing up. It was either to help with financial security of women. Second, education. How can we uplift it? And third, healthcare. So very core topics to me as a human, not
mm,
for business. And because I grew up and was exposed to medical devices, that's
mm,
how I got into healthcare. My family exposed me to it. And that's also, I think, what made me stick, though. Knowledge is one thing, but what made me stick to it was when I actually went around the hospitals myself. Then I
mm,
saw the challenges in our country that I
mm,
thought at that point was solvable. And it's just so frustrating when you know something's solvable, but it's not getting
mm.
solved.
Yeah.
And I think that's what every entrepreneur
Mm,
strives to solve something where there's a problem and they know there's a solution.
mhm,
And that's what made me stick to healthcare. So that's when I started renting devices to hospital. A simple ventilator, instead of selling it, we were renting it. Why?
mm,
Hospitals couldn't buy the right amount of equipment at the right time.
mm,
So ergo, they have this equipment in the hospital, but they're not sure how many people will walk inside their ICU. So what happens? There's always a mismatch of available supply versus the demand coming in, because it fluctuates. So this model, the model of renting, paying only underutilization models, was very good for hospitals because they didn't need to buy these machines anymore. They could just call us, we bring the machine, and they pay for what they use. So it was very good for hospitals because then they could save on their capex. And when they save on their capex, the bigger goal is the hospitals can now spend on the other things, especially their personnel, the service, right? Pay for more nurses, pay for more doctors, pay for more education programs. And this was one less problem to worry about. So that was the model that started Equilife, and it's been working since. We've expanded into more machines, more hospitals. So that's why we're a back end company. You won't really hear of us so much, but we help run things in the background. And yeah, so I think you mentioned it a while ago. We started to transition and open some services for the home as well. But our background is really in supporting hospitals. And that's what gave us the backbone, infrastructure wise, to know how to take care of people and families.
Thank you for that, Abet. I can only imagine the impact you have, as in, I think, matter of life and death for hospitals to have the equipment they need to care for the patients who need your machines. Diba? At least may supply to fit the demand.
Yes.
And yeah, I think after 10 years of Equilife being in the background, it's time to really highlight what you do so that more people will be aware that they can turn to you to rent. If you are a hospital and you are not yet working with Equilife, please visit their website, equilifemedical.com, and reach out so that they can respond to your inquiries and so they can help you with your patients po, no, para matulungan po natin sila. Abet, next question. So as I was preparing my questions and preparing for this interview, I was going through your website over and over. As in, para ko na siyang kinakapisado. And then the words access, operate, and manage. No? So these three keywords stand out to us when we go through your website. Please expound on each of these keywords for us.
Okay. So why we're zoning in on these three things? Because the way we see care happening in terms of critical care equipment, for example, the biggest issue we first needed to face here in the country was access. Do we have enough of the equipment, right? The problem was right equipment amount at the right time. So, access. So, when we started to solve that access part by renting the equipment to hospitals, opening lease or utilization models to hospitals, we opened access. Suddenly, it became more accessible, democratic to access these devices. You didn't need millions of pesos to buy one ventilator anymore. Excuse me. So once we solved that, other challenges started to open itself to us, such as once you put a device inside the hospital beside a patient bed, generally doesn't run on its own. You need doctors, you need
Right.
nurses, respiratory therapists. And this is almost for every other equipment, healthcare equipment. It's a marriage of the human side and the device side to heal a patient. So that's when the operate side had to come in. Because, okay, we gave you access to equipment, but the equipment wasn't used to its maximum potential to help the person get better, the patient. So then we had to open operational side of the business. So can we put people boots on the ground to support the doctors and the nurses with with whatever they needed to know about the equipment, the technical side, right? So that's when we started placing respiratory therapists and some trained nurses into hospitals to help operate this equipment with the hospital personnel. So these are our employees who actually work in the hospital with the providers, with the goal of making the patient better. Because it's a teamwork, right? Like in any hospital, you have a care team, and we are part of that team. The
Mm,
device is, but we now put humans because
mm,
it's needed. Eh.
yeah.
And then the third part is continuity management. Because, okay, you place the equipment, you solve the access problem, you have people to help operate it. Number two. Third, these are equipment, they break down. They're not going to be all good forever. They need to be repaired, maintained, managed, replaced sometimes, right? Um, and this is part of continuous care. So that's how we looked at it. We never looked at ourselves, and I never wanted to build a business that merely, to be very blunt, dump machines into a hospital to make money. It's not that.
Mm,
How do we make sure the patient gets better? That's the
mm,
challenge we put on ourselves. So placing a machine was the very basic thing we could do. We
mm,
needed to now put a management angle. So we provide biomedical technicians and engineers to make sure these equipments don't conk out when you need them. And if they do, because they're equipment, things happen, right? The
right.
alarm or whatever, you have engineers to call, you have people to replace the machines, and again, we feel that that formula enables hospitals and people taking care of patients to work better because that's our goal. So I think that's why like our mantra are those three things. We help hospitals and patients access. We make sure it's operable. Third, it's sustainable. There's somebody you could call at the end of the day if something happens.
Mm, tama. At saka if you have your personnel there to operate it, magaguarantee rin na tama yung paggamit. So, tama yung result. 'Di ba, Abet?
I think it's not just about operating it correctly. I
Mm,
would even go the next step, right? And this is what a lot of healthcare providers are trying to do now. Let's not
mm,
give the bare minimum na gumagana. Hindi.
mm,
Dapat nagagamit natin yung technology na available. So, if there are new technologies or modes available in an equipment, we have to drive the equipment to help the patient at that level. It's like having a nice car but only driving it at 10 kilometers per hour.
mm.
That's what we
Correct.
don't want. Filipinos deserve better. If there's new modes and new technology and the equipment is there, we should use it.
I love that. Gusto ko yon. Filipinos deserve better. That's so true. And that's what Kaya founders and Pulse 63 are working towards for all of you. Okay, so speaking of you were mentioning your people, your team, no, your staff. Last November when we went to your event at Manila Hotel, we met some of them. And then you go to the website and you see there are a lot of happy people. It's such a big team. Tell us about your team, Abet. Who are the people of Equilife Medical?
Sure. It's amazing because it is quite hard work. I mean, it is hard work to say the least. We operate 24/7. We have a team that runs 24/7 because it's crit care, right? If somebody
Mm,
can't breathe, you can't really wait
mm,
and say, I'll deliver something tomorrow. So we're trying to do everything we can to get the goods out, to get problems solved as fast as possible, just like in a hospital, because we work together. So the people in the company are a big mix of hospital professionals. So these are people who actually work inside the hospital, nurses, respiratory therapists, a big group of biomedical technicians and engineers who have to repair the equipment. So it's a lot of that. And then you have a lot of supply chain people also who move the equipment from one place to another. Because you can imagine, we help a lot of hospitals. So our
mm,
cars go out at night, these kinds of things. You don't notice us in the mornings. We usually start moving things um, when it's not two peak hours, so we
mm,
can move faster. And actually, a lot of business professionals already. In the beginning, it wasn't a lot of business professionals, but as the years progressed, the the challenge of solving it became more, I would say, challenging or attractive to non-medical people, because the value you could give was so immediate to a family that there was this deep appreciation to work in healthcare. Like, of course, there's this gap in terms of understanding healthcare and the healthcare world. But with the commitment of these new business people coming in, not just in a financial aspect, but in terms of value creation,
mm,
that's what increased the number of these analysts,
mm,
consultants, um, marketing, sales, customer service people coming in, because they
mm.
really wanted to bring value to the patient. And it was so immediate.
Yeah.
You help a family, you literally help keep a person alive. And that is so like valuable to so many people, so worth their time. Sometimes is what they say. And that's what I believe personally.
Mm,
I believe in doing things that are quote unquote worth our time. Look back and say, what were you doing for 10, 20, 30 years? And
mm,
I was being useful to the world.
mm,
And for me personally, that is a job well done. That is time well spent. That's brain power used correctly.
mm. Nice. Wow. When you save a life, my goodness, you're really saving a family. So thank you to the team of Equilife Medical. Thank you.
Yeah,
Let's
they're one
focus
of the most
on.
hardworking people ever. So hats off
Um,
to them.
can imagine. I can imagine. Let's talk about your services. So we've mentioned a few, but let's talk about them before we focus on your new pulmonary machines. No, ito kasi yung mga nakita ko dun sa Manila Hotel po na event nila Abet nung November. So the services of Equilife Medical are medical equipment rental, pulmonary services, home care services, medical supply sales, medical equipment sales, and biomedical engineering services. So maybe walk us through your services, Abet.
Sure. So we're highly specialized in critical care um, services and equipment. So that means, I think I mentioned it a while ago, these are breathing devices. They're called BiPAPs, CPAPs, NIPPVs, high flow devices, um, nebulizers, mechanical ventilators, um, also other things in the ICU, such as but not limited to patient monitors, halters, infusion devices. I could name it all. Pulse oximeters. But I think you just think in a critical care unit when you have to monitor a very sick patient, what do you
Mm.
need? And these are the equipment we help hospitals fit in so that the people who are working there have trusted and quality and tested devices. And of course, a lot of these equipment need specialized supplies. So these are not typical supplies you find in drugstores, for example, because they are niche. So we have to provide them. Part of being vertically integrated is the question is, can I use it in 30 minutes? I
Mm.
always tell my team that we're not selling something for the sake of selling something. We are
Mm.
selling something na magagamit, na dapat magamit in under 30 minutes pag nandun na.
Mm.
Yun yung tanong, kaya ba? Kasi kung hindi, ano yung kulang?
Mm.
Hanapin natin. So that's why this is so integrated. It's very niche, but it's end to end.
Right, right.
Because the worst thing is, and this has happened before when I was going around the hospitals when I was younger, I mentioned to you a while ago. Um, there's so many gaps that sometimes families have to find things on their own, or
Mm.
hospitals get pressured, let's say some supply hindi na order, naubos, because there's so many little things to help one thing.
Mm.
The vertical integration became so important to the company. And that's why we started focusing on a niche service, critical care.
Mm.
We're not going out and saying we can do this for any type of equipment, at least not yet, or any type of health category. But we will go deep in one category and be very good at it because ayaw namin may kulang.
Mm.
So yeah, those are the kinds of supplies we sell. The services around it, like the nurses, the therapists, those are
Mm.
also very trained people for this specific field. So it's not just about knowing how to operate a computer. They literally know how to adjust settings on machines to
Mm.
help you breathe. But yeah, it's very niche, but it's very focused. So it's specialized. And I highly believe in healthcare being specialized
Mm.
because we don't need everything at the same time. We need something at a certain time. And we want to make sure that the hospitals and providers we work with are able to give us that something we as patients need at that specific time we're sick. And that's what Equilife is, a specialist in critical care and pulmonary care.
Tsaka ang naisip ko, Abet, no, if it's the patients and their families who have to look for the missing components that are needed, mamaya nag-agawan pa sila. You know what I mean? Parang, so definitely may isang hindi makukuha yung kailangan, no? So, wow, nice. Tama ka,
Exactly.
end to end nga. Yeah, you
And
really have,
time, and this is sorry to cut you, but this is
it's
the time
okay.
where everything is so important because it's critical care. Every
Mm.
minute matters. Every minute you're not getting oxygen in your brain
Mm.
matters. So
That's
that's why vertical integration of specialized spaces is very important because those are the gaps you can't afford to miss. And it's not even because it's super expensive. It's just because it's a lot.
yeah. At least with Equilife, sigurado na kompleto na. No, you won't have to look for any component that's missing or fight with another family of a critical care patient over it. So thank you for that. Um, let's focus on your hospital clients, Abet. No? 10 years na ang Equilife. 10 years since you founded Equilife Medical. What can you say have been your greatest accomplishments? And then what milestones do you still want to accomplish with your hospital clients? Let's in the next 10 years.
Wow, that's exciting, right? Like what they say about businesses and entrepreneurs. So jumping out of that healthcare hat, but more into a value creator hat, um, is companies and entrepreneurs go through phases, and getting past your first year, second year, 10 years, 20 years, 50 years in business. um, I think what I'm very proud of, in the last 10 years, was getting to start this very early. I'm very happy for that. So that's one. Why? Because I think it's also a time race in terms of solving these deep set problems in healthcare. When I'm asked, um, are you happy you started early? Yes, I even wish I started earlier. Um, I got a lot of questions because when I was going around hospitals, I was only 24, 25. And like, you're so young. That's the question they would always ask.
Mm.
And then my learning then was, it's actually a great thing I'm young because I have more energy. I
Yeah.
didn't have um, too many, um, I think, things to worry about outside.
Mm.
I just had to worry about my clients and my business. So I'm happy I got that phase to really focus on it. So that phase, I was able to really understand my clients. I was able to understand my people, my team, meet the people, make time, because that really helped me connect with the value I was building. And that is very important. And I think that is what inspired me, and it continues to inspire me to build more lines, businesses in healthcare. Um, because I understood and I saw how deep the well run.
Mm.
And I know I haven't even hit that, the bottom of it, like the end, because it's just so deep. There's so much. So that's one. Um, in the last 10 years, I'm very proud that because we started early, we got to get to know our clients. We got to help by now hundreds of thousands of people easily.
Mm.
Um, were able to meet so many end users. And when I say end users, these are the doctors, the nurses, the allied professionals in healthcare, the non-medical people in healthcare. We met so much people, and that gave us an understanding, and me an understanding of whatever needs to be addressed, or at least what
Mm.
needs to be addressed in the country. So I'm very proud of that. I'm also very proud that my company, or Equilife Medical, has partnered with some of the biggest training institutions in the country. That
Mm.
makes me so proud, because that goes to the point of democratizing healthcare, that you don't have to be the key hospital in the most expensive city in Manila
Mm.
access quality equipment. For me, the beauty was when we started partnering with government hospitals, because
Mm.
that's where we saw the democratization of it. It became really accessible. It was core to us. Access was real.
Mm.
That made me really proud, because not only because we met amazing people in these training hospitals, very hardworking, but also it built a backbone with my team. They learned how
Mm.
to take care of people at a certain level. It was
Mm.
hard. Some people would, of course, cry, complain. There are people who came and go, but the ones who stuck, they're the best,
Mm.
because they've gone through the fire. And I'm very proud of that. That it didn't only help people, but it helped people grow. Like the people
Mm.
I work with, it helped me grow for sure. And
Mm.
then that's for the last 10 years. And now for the future 10 years,
Mm.
I think it's what I'm very excited about for Equilife is we're starting to see how we can do vertical integration of this service in other areas of a hospital. So,
Mm.
can this be done in surgery? Can
Mm.
this be done in imaging? right? The right amount of equipment at the right time so everyone can access. That's what we're starting to test now. And the second one is testing direct to patient services. So this is
Mm,
that home care side. Because
mm,
I mean, we've been helping some people, especially during COVID, right, to access this equipment at home because they didn't want to stay in hospitals. But just a
mm,
disclaimer, not every equipment should be used for home. So we don't do that because you need, again, it's not enough you have the equipment, you have to have the service side, right?
mm,
Um, but we're testing that as well. We're working with medical professionals to help bring patients home. So these are patients who used to be in the ICU but are more stable. They're ready for going home, but they still need the device. But they're discharged. So that's the big difference. The very emergency side is over, but there is continuum of care that's needed. And
mm,
that those are the people and the families we're trying to help go back home. So that the environment for the sick patient, for example, you're on a ventilator, um, you don't want a hospital environment anymore, right?
mm,
Because you're stable, but you still need the device, you still need treatment. And the family also, it's stressful to a family. I mean, those are the things, if we want to jump into home care, um, the, the, the benefits of this is not just accessibility. It's mental and family ties driven because
mm,
having the truth is taking care of a sick patient is difficult, not just for
mm,
the patient, but for the carers,
mm.
the families, right? And I'm sure a lot of Filipinos have experienced this because we're very caring and we want to take care, right, of our
Mhm,
own. And um, it's very stressful to live in a hospital environment.
mhm,
So these are ways to make things easier for families to care for someone at home. So that's what we're trying to focus on in the next years as well. How can we make this smooth? How can we make it not just economically, but
mm,
mentally um, easier for the
mm.
families? And you talk home care, for me, I don't just talk patient, I talk family.
Yeah.
Unless you're living, of course, alone at home, then it's totally okay. But usually, if you don't, that always affects a sick person at home, affects family life. And that's the truth. And care and support needs to be built around that. So
Mm.
those are the things I'm excited about and my company is excited about in the next years to come.
Thank you so much for tuning in to this episode of KaiZEN, the Kai Magsanoc podcast. We'll see you next week for the next part and the continuation of this episode that you just tuned into. KaiZEN is available on Spotify, and you can also watch our video on YouTube and, of course, on the TayoTayo.Health Facebook page.